Over time, as we age, the most common change you see in brain function is changes in the speed of cognition. So that translates itself into that it takes us longer oftentimes to retrieve a memory. It takes greater effort to concentrate. But loss of memory, the kind of loss of memory that you see in people with Alzheimer's disease, is not part of normal aging. We all, as we get older, start to have tip-of-the-tongue problems where we're trying to remember something or remember a person's name and it doesn't come to us, but then it comes to us a little while later. And what that is manifesting is a very common change in aging, which is troubles with the speed of retrieval. And the more you feel anxious, the more retrieval and memory is difficult. So if you start to become anxious over the fact you're not remembering something, you make it more difficult then to recall it. But ultimately, actually, when some of that anxiety mediates and time passes, you'll suddenly get it and go, oh, that was his name, oh, that was what I was trying to think of. That's very different than the memory loss that you see in Alzheimer's disease. In Alzheimer's disease, the memory is very difficult to retrieve, particularly short-term memory. So for example, if I teach you, say, tomorrow I'll be over at 11, and then ask you, say, an hour later, what time will I be over tomorrow? Someone with Alzheimer's disease very well will maybe remember, well, you said you'd be over tomorrow, but I don't remember what time it was. Someone with normal cognitive changes with aging might need a little bit of time to concentrate and say, no, what was that? You know, oh, right, it was 11 o'clock. So that's a key difference between the cognitive changes seen as we age that are part of normal aging versus the cognitive changes that are seen in someone who has a disease like Alzheimer's disease. The chief risk factor for developing Alzheimer's disease is age. The longer you live, the more likely you are to develop Alzheimer's disease. And in the last 2 centuries, from 1900 on, we have seen an unprecedented growth in average survival. At the beginning of the last century, in 1900, the average survival in the United States was in the 50s. Now it's into the 70s. So we are seeing an increase in the number of people who have Alzheimer's disease because we're seeing a dramatic increase in the number of people who are living into their 7th and 8th decade. So Alzheimer's disease is not just a disease of memory loss. True, the earliest and most significant symptom are problems with short-term memory. You tell someone something like, I'll be over to your house on Saturday, Mom, to take you to dinner, and you come over to your house, and she says, what are you doing here? But patients with Alzheimer's disease have other problems that are not just memory problems. One of the most significant problems they have are problems related to what we call neuropsychiatric symptoms. And the common problems include apathy, depression, anxiety, psychosis, and agitation. Apathy is a particularly frustrating symptom in people with Alzheimer's disease. It simply refers to a lack of initiative, and it can often be confused with depression. Someone who's apathetic simply lacks the drive and initiative to do things, as well as an interest in other people's plans and activities. That can look like that person is depressed, but if you ask an apathetic patient, are you basically satisfied with your life? They'll tell you yes. Are you afraid that something bad is going to happen to you? They'll say no. In other words, they won't show the symptoms of depression. They'll look, though, for all the world like they're depressed. The point being that an apathetic patient is also a very difficult patient to be around. They really lack initiative to do things, and they start to show less interest in what other people are doing. And they really create an obligation on the part of the family. Oftentimes, we start to begin to call the family even caregivers, to take the initiative to get the person involved in activities. Another common problem seen in people with Alzheimer's disease is depression. They can have very significant problems related to feelings of hopelessness, anxiety, and these are potentially treatable if they're properly identified. Another common problem seen in people with Alzheimer's disease relates to delusions and agitation. People with Alzheimer's disease may begin to believe things that are not true. For example, someone broke into the house and stole my wallet, when unfortunately what's happened is they've misplaced their wallet. And these can become so severe that the person can become difficult to be around because they start to become resistive to family, they start accusing family of doing things that haven't been done. All these problems are very common problems seen in people with Alzheimer's disease. In particular, over the course of the disease, at least half of patients with Alzheimer's disease will have at least one of these neuropsychiatric complications. So it's important that a patient with Alzheimer's disease is in touch with physicians who are not only skilled in identifying the cognitive problems, but also in managing these neuropsychiatric problems as well. So a common belief that's often talked about with Alzheimer's disease is that if you're aware of your memory problem, it can't be Alzheimer's disease. Or the flip side would be, people who are unaware of their memory problem are the people who have Alzheimer's disease. And the reality is really, unfortunately, not so simple. True, loss of insight or awareness of cognitive problems is a common problem seen in people with Alzheimer's disease. But it simply isn't the case that people who are aware of a memory problem don't have Alzheimer's disease. Particularly in the very mild to even the moderate stages of the disease, many people with Alzheimer's disease have at least some awareness that there's some change in their cognitive abilities. And some of those patients are very bothered by those changes. So I think clinically that becomes a very important point for both the family and the physician to be aware of, because to the extent that someone is feeling their memory loss, it's a lot like pain. And a very important point I like to make to patients, and more importantly to families, is if you are feeling your memory loss, if it is bothering you, it's something to talk about and not to make light of. I mean, it's particularly, imagine how difficult it is for someone with pain to be told by other people, oh, that's nothing, my back hurts as well. Well, the same thing I think applies to someone who's complaining of memory problems who has Alzheimer's disease. They shouldn't simply be told, oh, we all have our memory problems, and try to make light of it. The more people complain of the severity of their memory loss, that's more correlated with their anxiety and depression than it is with the actual severity of their memory loss. So someone who comes in and says, I have a terrible memory problem, it's horrible, they're probably telling you, I do have a memory problem, but also I have undiagnosed anxiety and depression that needs to be treated. In addition, when you're seeing people with memory problems, you want to look for not just potential cognitive causes, but also medical causes for memory problems. One very common source of cognitive complaints are the medications that people are taking. Some of them can have side effects that lead to difficulties with concentration and attention, which can look like, for all the world, a memory problem. And again, it's only until you get into an evaluation and look at their medication list, as well as get a more careful history, that you realize what I'm dealing with are the side effects of one of their medications and not a memory problem that's seen in early Alzheimer's disease.